So hello again, welcome to this webinar. My name is Courtney Gedengle. I'm a senior physician researcher at RAND. And today we're going to be telling you about the Implementing Diagnostic Excellence Across Systems Ideas project. We're going to focus on CalibrateDx, which is one of the tools we'll tell you about, but we're also going to give you an overview of the project itself as well. We're going to leave time for questions at the end, but if you have any questions as you go along, feel free to pop them into the Q&A box. You'll see that it should be at the bottom of your screen, and we'll turn to those questions once we're done with the formal part of the presentation. So again, thank you so much for being here today. We're really excited to tell you about this project. So as you know, diagnostic safety is really a critically important area of patient care and patient safety. We know that diagnostic safety events contribute to preventable harm in 1 in 20 outpatient visits. And in the inpatient setting, up to 25,000 stays per year are affected by diagnostic safety events. And in fact, they're the most common root cause for medical liability claims. And because of this, healthcare organizations, clinicians that care for patients really need actionable, practical, and flexible resources that meet their needs to help them in supporting diagnostic safety improvement efforts. And to tell you more about that from AHRQ's point of view, our funder, I'm going to turn it over to Margie Schofer.
Thanks, Courtney. Hello, everyone. As Courtney said, I'm Margie Schofer, and I work at the Agency for Healthcare Research and Quality, otherwise known as AHRQ or AHRQ. And improving diagnostic safety and quality is an AHRQ priority. And to that end, we've developed a bunch of different resources to promote diagnostic excellence. These include a series of issue briefs on different diagnostic safety topics, as well as the 3 toolkits that are the focus of this implementation and sustainment support project. 2 of the toolkits, CalibrateDx, which we will be primarily focusing on today, and MeasureDx were developed for AHRQ by the Baylor College of Medicine, and the patient toolkit was developed by the MedStar Health Research Institute. All of the resources were pilot tested as part of the development process to understand barriers and facilitators to use, as well as perceived impact. And then we use those evaluation findings to revise the tool. We at AHRQ are very interested in getting these tools spread more broadly. And we know that in order to do so, we ideally need to work with healthcare organizations to provide training, implementation support, as well as support for you to continue using the resources once the implementation period has ended. So to do that, we've awarded a contract to RAND to get these resources into use, with a goal of having each resource implemented in at least 50 healthcare sites across the US. And while we mention all 3 of the resources that are part of this project, we'll be specifically focusing on how you can use CalibrateDx to help you evaluate and calibrate diagnostic performance for the purposes of learning and improvement. So with that, let me hand it over to Sangeeta.
Thanks, Margie. My name is Sangeeta Ahluwalia. I'm a co-director for the RAND Ideas project with Dr. Courtney Gedengle. So Ideas is aimed at improving diagnostic safety across different settings and different users with these 3 different resources that participating sites can choose from. The toolkit for engaging patients to improve diagnostic safety focuses on patient-clinician communication and is ideally implemented in office-based settings. MeasureDx, typically used by QI or patient safety teams at the healthcare system level, really focuses on using existing data to measure and then improve diagnostic safety in any healthcare setting. And then finally, CalibrateDx is aimed at improving individual clinicians' diagnostic performance and can be used in really any healthcare setting by clinicians whose scope of practice includes diagnosis. As you've heard, today's webinar is about Calibrate. I want to provide a quick overview of the other 2 tools before we turn to Calibrate. If you're interested in learning more about any of these tools, prior informational webinars are on the AHRQ website, and you can also feel free to reach out to us at ideasproject@rand.org, and I'll repeat that at the end. So the toolkit for engaging patients to improve diagnostic safety was developed in collaboration with both patients and clinicians. It's aimed at improving communication during the patient-clinician encounter, and it's aimed at engaging patients directly in their care while helping clinicians hear and reflect on their patient's story to reduce diagnostic harm. It has 2 easy-to-use components. The patient component is a worksheet that helps patients prepare for having a conversation with their clinician. And the clinician component consists of a brief training, and one-page planning worksheet that helps them provide a full minute of active listening without interruption at the start of their patient visits. As noted earlier, any office-based practice, primary or specialty care, can use the toolkit. Ideally, even an entire clinic can roll this out among their clinicians and patients. It's that easy to use. MeasureDx, as I mentioned, designed for QI or patient safety teams, aims to help sites use data that they already collect as part of their QI work to identify diagnostic safety events and then learn from those events what systems and processes could be improved. It guides teams through 4 steps. First, it helps prepare the organization for diagnostic safety measurement. It then assesses organizational readiness for measurement. Third, it helps teams pick a specific measurement strategy for diagnostic safety. And then it helps teams walk through reviewing and analyzing cases of interest that are picked up through that measurement strategy. Any healthcare setting or site, even those who are newer to learning about diagnostic safety, can implement MeasureDx. It is ideally implemented by QI or risk management or patient safety teams that have access to patient-level data that can be used for measurement, tracking, and improvement purposes. So as I mentioned, prior informational webinars about each of these 2 tools are on the AHRQ website, and I will share our email address at the end of this talk. So today, let's turn to Calibrate. That's our focus for this informational webinar. So why use CalibrateDx at all? Delayed, wrong, or misdiagnoses are common challenges for patients, families, and clinicians, but individual clinicians rarely receive feedback on their diagnostic decision-making. This lack of feedback to clinicians can sometimes lead to what is known as a calibration gap, which is the difference between one's perceived diagnostic performance, so how you think you did, and one's actual diagnostic performance. Clinicians who are aligned on their diagnostic accuracy and on their confidence in diagnosing patients will achieve diagnostic excellence. And that's really what this tool aims to address. CalibrateDx was developed at Baylor College of Medicine in partnership with MedStar. It's been tested in collaboration with clinicians at multiple institutions. The tool uses active reflection strategies and peer feedback to improve clinicians' diagnostic calibration and to improve their confidence in diagnostic performance. It includes a self-evaluation tool that walks clinicians through selecting and reviewing their own cases, reflecting on their diagnostic performance with those cases, and then debriefing with a trusted colleague. It really aims to empower clinicians to learn from their own clinical practice through structured exercises and tools. It guides clinicians through 4 specific steps. So first, specify or picking an area of practice to focus on. These can be commonly missed or delayed diagnoses or specific high-risk situations of interest. The second step is evaluating a set of cases for learning opportunities, typically 3 to 5 cases on a quarterly basis to go back and pick within that area of practice, and then to identify learning opportunities through the use of the tool. The third step is planning and applying improvement strategies to sort of shift diagnostic performance and begin to take actions in current clinical practice. And then the fourth and final step is a reflection step to really reflect on this calibration exercise iteratively over time. So as part of this project, who can test CalibrateDx? We're looking for sites with at least 4 to 6 clinicians willing to test CalibrateDx. So for CalibrateDx, because you work with a trusted colleague for some of the debrief activities, we're looking for pairs. So 2 pairs, 4 clinicians, 3 pairs, 6 clinicians. And really small and large group practices are eligible. Departments that are within clinics or hospitals, even physician or other clinician training programs like residency programs can test CalibrateDx. So why implement CalibrateDx as part of this project? This project really offers a unique opportunity to use an innovative method for advancing diagnostic safety that's particularly focused on individual clinician practice. Through this project, you'll receive tailored support and training on how to use CalibrateDx, and I'll talk about that in a second. You'll be able to connect with other sites who, as part of this project, are also using CalibrateDx. The use of CalibrateDx has the potential to reduce opportunities over time for legal claims and lawsuits. And as part of this project, you will be able to obtain CE credits and MOC credits as well. There is a modest stipend for sites who sign up to participate in the IDEAS project. So I mentioned support that this project will provide. That includes brief and flexible training, so tailored towards the needs of clinicians and the schedules of clinicians for all sites and all participants. Those include things like resource-specific materials and tip sheets, tip cards. We provide hands-on assistance during the project, including a dedicated email for questions and office hours with content experts, those who really know how to use CalibrateDx in clinical practice. Of course, the learning collaboratives with other participants who are also using CalibrateDx. And we will provide aggregated feedback on the impact of the intervention to participants at the end of the study. So you'll have a good sense of how and in what ways the use of this tool has changed diagnostic performance at your site. So what would a site need if they were interested in implementing CalibrateDx as part of this project? It is a 2-year effort. It includes 1 year of implementation where you're actually using CalibrateDx, as well as a 2nd year, as Margie mentioned, focused on sustaining the use of CalibrateDx and maybe even expanding use of CalibrateDx to other clinicians and other departments. We are looking for executive support for the site's participation in this project. Of course, a handful of clinician participants who will actually use CalibrateDx engaging in the project activities. It helps to have a site champion at each site to help coordinate project activities and communicate with us, the project team. Of course, clinicians who participate in this will need access to medical record data of the patients that they are reviewing, of the patient cases that they are reviewing. And it will be helpful to identify site-specific contacts who might be able to help any concerns around privacy, security, or confidentiality to work with the relevant colleagues on our team. I want to close by highlighting some of the feedback that was received during the pilot test of Calibrate. So these are quotes from pilot users of CalibrateDx. The first one says, "I think it's helped me reason more and explain more of my reasoning in my documentation," which I think is really important. They say, "I think it's helped me naturally think about other factors at play in my own decision." Another user really focuses on the peer feedback debrief component. Hearing the reinforcement from my colleague and the recognition of, "This sounds like it was a really challenging case, but you did the best that you could. Maybe here's 1 or 2 things that I would have done differently that you could apply in the future." I think it was good camaraderie building and also reinforcement that we did the best we could. And then, of course, my favorite, "I'm absolutely going to keep using this," from another pilot user. Just a quick overview of our timeline. You can see the 3 tools along this timeline and Calibrate at the end, which we plan to begin rolling out in August of 2025. So you have some time to think through participation and get into place all the necessary processes and procedures. We will start with a training period where training is open to clinicians who want to learn how to use Calibrate, followed by the implementation period and then the sustainability period. We are planning to begin our rollout with Toolkit for patient engagement. That's upcoming this March, and then MeasureDx in June, and then again Calibrate at the end in August of 2025. So I promised the contact information. You can see the AHRQ website, www.ahrq.gov/ideas-project. That's where you'll find a lot of information about all 3 tools, as well as the informational webinars that we've already held. And then you can reach Dr. Gedengal and myself directly if you have questions, want to learn more, or are interested in signing up by just emailing ideasproject@rand.org. And that QR code will also take you to our project website.